Oh, now it's working? Okay. Okay. Is that my, was that?
No, it's somebody. Someone from
Okay.
nine.
If you, if people could mute,
They need to. Can you please mute?
can everybody mute their link?
You can mute everyone. If you open the people.
Yeah.
How do I mute?
Well, first of all, you say, okay.
Yeah. Okay. Participants and click on them. Yeah, and there should be mute all. Yep. Always something new. Hi. No.
The clicker still working? Right, yeah.
Okay. All right. Intriguing.
We have a lot of people joining us online. Maybe we give, how about we give another a couple of minutes?
Okay.
Oh, yeah, I told you that it seems that if you have the initial. It seems that. Yeah. In the distance of the camera of the person. Yeah, for example, for this one, we have about some people, one is it is all not
Can
complete.
everybody there hear?
We just mute.
Just make sure.
Yep, we can hear you.
Okay, great. Thank you. All right.
We can get started.
Okay.
Hello, everyone. Welcome to join Smart Health seminar series. Today, our topic is MRI and health at FAU and beyond, given by Dr. Andrew Newberg. He is the MRI medical director here at FAU. Dr. Newberg has over 30 years of experience with imaging, particularly neuroimaging of neurology, psychology, and various mental states, and he has published over 300 articles and chapters in these areas. He brings this experience to help FAU faculty and students to develop their own unique project with the MRI facility. So in this seminar, Dr. Newberg will provide an overview of the center, its equipment, and the types of the brain and body processes that can be studied using MRI. He will also highlight examples of the current and past projects and discuss how faculty and students across FAU can develop innovative research using this center. So please join me and give a warm welcome to Dr. Andrew Newberg.
So for those of you who are online, I probably got the camera on one side, I've got the people on the other side, so I'm going to do my best to kind of look both ways without getting dizzy. But anyway, as you heard in the introduction, I'm the medical director for the new FAU MRI Research and Discovery Center. So it's on the Boca campus next to the School of Medicine. And it's really an incredible opportunity for FAU. This is a fantastic devices we'll be talking about. It's about a $5 million scanner, has a lot of bells and whistles, so you can do a lot of wonderful things to look at all aspects of the body. Obviously, a lot of focus will be on the brain, as we'll talk about, but we really can look at pretty much anything in the body. And so part of the goal of this whole presentation is to give all of you a sense of what is possible. Give you a little example of some of the research studies that I've done over the years. Not specifically with this MRI scanner, but we'll also talk about some of the studies currently going on. And most importantly, what I hope everyone takes away from this is that if there's some project or something that you are interested in, either as a student or faculty member or your group or whatever, we're here to try to facilitate that and to try to help you to develop projects. Even if you don't have background in MRI, we are able to help develop different projects and programs around whatever it is that you might be interested in doing. So naturally, it doesn't work now. All right, we'll just. There we go. Okay. Now it's working. Okay. So as I mentioned, this is it's about a $5 million scanner. It is called a Signa Premier. It's made by GE, and that's an image of what it generally looks like. It has, again, a lot of really exciting technology. So because it is a relatively new system, we just put it in about a year or two ago. And so it's got all of the AI stuff and a lot of abilities to do all different kinds of studies, as we'll talk about. And we also, as I mentioned, have additional bells and whistles, if you will. So we have the ability to do things like EEG. We have the ability to do functional imaging. We can present. We have video cameras, so we can present different stimuli to people. We either visual or audio. We can get responses from people. So there's a lot of different things that we can do. And me and my team, again, are always happy to help you if you say, gee, can we do some kind of video presentation to people? Yeah, well, we probably can. We just have to kind of figure out how to do it and ultimately how to derive some kind of imaging from it. So again, this just gives you a little bit of an overview of what the scanner can do. And I'm going to talk about this in a little bit more detail in a few minutes, but it's got a pretty nice sized bore, which is helpful. So for those of you who are not that familiar with MRI scanners, it's always a little bit of a tight fit for people to get in there. But it is reasonably open, so it does help, at least as far as things like claustrophobia goes. It's a very powerful scanner, so it is on the magnetic field strength of 3 Tesla, which if you know anything about MRIs, it's certainly kind of the strongest in the clinical use. There are some research scanners that are up to 7 Tesla and maybe even a few that are 9, I think. But this really kind of, is a top of the line scanner to be able to do all kinds of clinical and research work. But it is not a clinical scanner. So it is for FAU. It is for all of your ability to do different research types of projects. And that's what makes it very exciting. A lot of times when you work at different facilities, the scanners are being used for patients. And so getting on a scanner can be really difficult. At the moment, because the whole project and the whole program is kind of starting, there's a lot of opportunity to get on the scanner, to be able to do different things. And we expect it to be used widely throughout the university. And that goes for both medical as well as all of the other disciplines throughout the university, as we'll talk about. So again, for those of you who are not that familiar with MRI, so you've got the big magnet, which is what creates the big magnetic field. Always some interesting challenges with that because since it is developed through the use of superconducting coils, which means that even if all of the power goes out because of a hurricane or something like that, this scanner still is magnetic and it's still on. And it's an extraordinarily powerful magnet. You may have heard horror stories of people, kind of getting sucked into these things or getting even killed by these kinds of scanners. So we do have a lot of checks and balances in place to make sure that everything is done as safely as possible. But you have the big magnet, you have what are called individual coils, which fit around the person. Some of them are flexible coils if you want to do like a body image. We have head coils for doing a lot of the brain imaging. And again, it's integrated into a whole AI platform. So there's a lot of ability to do all kinds of interesting types of scans. So in terms of the kinds of studies that you could potentially do with the scanner, again, it's really pretty much anything. I think probably about 80% or so of the magnet ultimately will be used for brain or neurological or psychological types of studies. But we can do cardiovascular imaging, we can do gastrointestinal studies, joints and bones. If you're in sports medicine and you want to see how, you know, shoulders look or knees look or something like that, you can do that. We can look at soft tissues, organs, liver, you know, again, whatever you want to look at. And of course, we can do both functional as well as structural imaging. And that again goes for all the different organ systems. So you can just take a picture of what the brain looks like. You might want to see if there's atrophy, if there's a tumor, if there's a stroke or whatever, but you can also then do functional studies. So you can look at changes in things like blood flow, functional connectivity. Sorry, was that a question?
Snake, no.
Or was that? No? Okay, maybe that was just a. Sorry, we heard something in here, so we just weren't sure.
You want to click on to unmute themselves if they want to ask questions.
Yeah, they can unmute.
And click yes.
There we go. All right, and then just close that. And then we also have the ability to do, yeah.
Software for cell analysis of these images.
Yes.
So I don't know if you want to talk about that, like what type of, like, do you have all the software that are required, or we have to, for example, if we want to do analysis, we have to add purchase for the software using.
Sure. So the question, if everybody didn't hear, was about doing image analysis. It's actually something that we're still working on. You know, ultimately, since this is one of the core research facilities, I think we probably are going to try to move towards having individuals throughout the university who can help with things like image analysis, especially for people who are not as familiar with doing it. What's kind of good about image analysis is that most of the software programs are kind of freeware. So, you know, usually for either a very nominal price or, you know, just to be able to connect to it, people are able to use a variety of different analysis softwares. Sometimes they require training. So again, for somebody who's never done it before, probably hard to just suddenly start doing it. But for those people who have done it before, usually it's fairly available. But also what we're hoping to be able to do is to sort of be able to provide kind of from the image to the analysis, the entire package. At the moment, we don't have the formal ability to offer the analysis. But we do have people within our center, and we have people across the university who we can kind of connect people with in order to do analyses, which obviously also is important. Part of the reason why it's also a challenge is that it may also depend on what you ultimately want to do. So if somebody wants to do imaging of joints, that's a whole, like we may need them to be able to do their analysis their way. Some of the brain imaging is something that we are able to do and can help provide for people. I lose this ability here to this. Thank you. Okay. So we do have the ability to look at a variety of these different. So for example, we can look at brain structure, and you can look at whether there's individual lesions here in the brain. We can look at the vasculature through something called MR angiography. And as we'll talk about, we can look at a variety. This looks like it got a little out of order here. But we do have the ability to look at many different aspects when it comes to brain function. So we can look at things like cerebral blood flow in both normal as well as pathological conditions. So if you wanted to study people with depression or Alzheimer's, you could look at the changes in blood flow and look for certain patterns of activity. You can look at normal patterns, meaning that we can challenge people, get students to come in, and we can do different tasks to look at how they process emotions or how they do quantitation or whatever. So we can look at that both in normal as well as pathological conditions. And of course, the pathological conditions can include a full array of neurological, psychological, and in my life and career as an imager, I've had a great opportunity to be able to work with people in all the different domains to be able to look at this. Two of the main ways in which we look at brain activity is one is called BOLD imaging, the other is called ASL. So BOLD imaging stands for blood oxygen level dependent imaging, and it basically measures a signal related to the amount of oxygen that's in the blood. And this is extremely commonly used to look at activation studies. So you run a BOLD scan, And while the bold scan is being done, you give somebody a task, maybe they have to solve a math problem, and then they rest, and then they solve it, and then they rest. A lot of times you do that as a block design, it's called. And so that gives us an opportunity to see what areas of the brain are activated when the person is doing that particular task. ASL, arterial spin labeling, is another way of looking at blood flow in the brain. It's a kind of clever way. So when you're doing bold imaging, you're kind of looking at the entire brain itself and the oxygen levels throughout the brain. When you're doing arterial spin labeling, you're actually kind of giving a pulse, a radio frequency pulse, which is part of how the whole MRI system works, at the level of the neck, and then you're watching the blood flow as it goes into the brain. Again, that can also be used for looking at blood flow related to pathological conditions, as well as various activation studies. And activation studies are probably one of the most common types of approaches that are used, again, for just kind of learning how we as human beings do different things, but also how they may be affected by different diseases. So for example, if you're doing a study of emotional processing, you might want to have healthy individuals to see how they do emotional processing, maybe of faces or something like that. But you then might want to get people who have depression and see if they're using the same areas of the brain and processing emotional responses and so forth the same exact way. What people have also come across is being able to use things like bold imaging to measure the variability of different structures and how they compare to each other. And this is something called functional connectivity. So what we do is we have a person just in there in the scanner, and we have them just at rest, and we see how different parts of the brain are either operating together or operating differently. And that is also very useful, as we'll talk about, to look at different pathological conditions, normal conditions, the effects of different therapeutic interventions. Do they change the functional connectivity of the brain? So there's a lot that can be done with that. Diffusion tensor imaging is a way of looking at fluid diffusion in the brain, and this is frequently used to look at the sort of the structural connectivity in the brain, so the fiber tracts, and again, I'll show you some pictures of that, but it's looking at kind of the white matter, the tendrils that connect the different neural areas and neural pathways in the brain. That can be affected by different diseases, that can be affected by different interventions. We have magnetic resonance spectroscopy, MRS, which allows for the ability to look at different molecular signatures in the brain. There are some that we can do, there's some that we can't do. That depends a little bit on what you're interested in, but we sometimes can look at the amount of, for example, GABA in the brain, gamma aminobutyric acid, so certain neurotransmitters. You can look at other metabolites in the brain. So it depends a little bit on what you're interested in, but we do have the ability to do that kind of thing. We can look at a whole variety of different therapeutic interventions. So they could be, giving somebody, cognitive behavioral therapy. It could be giving them a medication. It could be doing brain games. It could be meditation. It could be, a whole variety of different interventions that you might want to look at. And also ways of trying to determine prognosis and directing therapy. So if people come in, we've been trying to do this with people, for example, with depression. Depression is not all the same. And so, is it possible that if somebody has depression and their frontal lobes are more active than somebody else, do they respond better to an antidepressant versus cognitive behavioral therapy or things like that? So we have a lot of possibilities as far as applications. Oops. So we have the ability to look at, again, different structural processes. The colors here actually represent the connectivity through diffusion tensor imaging. So, for example, the red areas are connecting left versus right, versus up versus down, and so forth. And so you can look at both structural connectivity as well as functional connectivity. You have the ability to look at just the brain structure. You can look at the central structures of the brain here, like the ventricles and so forth. You can look at whether there's atrophy in the brain. That can all be quantified. So there are different ways that you can do that. And so we have those abilities. Here is the arterial spin labeling kind of scan. So you can see the different colors represent the amount of blood flow. Usually here, the red areas are the more active, followed by the kind of the yellow, green, blue, and black. And again, you can look at this in a variety of different conditions, or you can try to have them activate through visual processing or something like that, and see how the brain is responding similarly or differently depending on the circumstances. So a couple of research examples. This is from my history of doing this kind of research, looking at MRI, just to give you all some thoughts and ideas. But again, there's just so many different ways of taking it. we've been very interested over the years, concussions become a big thing for people to look at. And so we've looked at concussions, and some of what we've done is to look for interventions for concussions, but a lot of it is just, what does a concussion do? I don't know how many of you have ever had a concussion or had a family member who's had a concussion, but oftentimes they go in for the doctor, go to the emergency room or whatever, they get an MRI scan, and structurally they say everything looks fine. And then they send the person home, and then a month or two later, they still have headaches, they still don't feel well, their light is too strong for them. So what's going on? And maybe they get another MRI and it still looks normal, but there's something else that's going on that's causing problems. So being able to look at the more detailed changes that are going on in the brain during a neurological condition like injury could be something that's very important for us to be able to understand the process itself, and then also to try to understand how to manage that process. So here is a scan that we did of diffusion tensor imaging, where the red areas are areas that are abnormal overall in a group of concussion patients compared to healthy controls. And basically what you're seeing here is that there's all kinds of abnormalities here. So even though you can't see this in a kind of basic structural image, you can see this when you do diffusion tensor imaging, and you can get where the abnormalities are. They tend to be a little bit more in the back of the brain, but really, all areas of the brain seem to be involved. So what this is suggesting is that even though you can't, see it on a more gross level, you can see this on a kind of a more microscopic level, if you will, that you can pick up using the MRI through diffusion tensor imaging, and you can say, gee, these people really have some significant abnormalities in their brain that help to explain why they have persistent symptoms. That's a huge issue when it comes to concussion. Some people have a concussion and then a week later they're totally fine, and other people have the same kind of concussion, and months later they're still really struggling and having all kinds of issues. So these are the kinds of things that we can begin to look at. We can start to correlate these changes with different changes in neuropsychological functioning. So we were looking at, I don't know how well you guys can see this, but there's at the bottom here, this little box where we were looking at neuropsychological tests like TRAILS, which is kind of a fancy connect the dots type of thing. And the faster you do it, the better your performance. So there were correlations between abnormalities in the functional connectivity, or to me, in the structural connectivity that we got with diffusion tensor imaging, and how people were doing on some of these tests. So it starts to, again, kind of build an overall understanding about what the disease process is and how it affects people. And then the next step would be, okay, so can we do an intervention to try to help people? And then do these kinds of changes start to improve? Can we start to see that on the scans themselves? Excuse me. We've done some other studies looking at different neurological conditions. So we've done some studies on multiple sclerosis through some of my work with the world of integrative medicine. Multiple sclerosis, if you don't know, it's a neurocognitive disorder. It's basically an autoimmune process that attacks the white matter. The problem with a lot of structural brain imaging is that it shows you that they have these lesions in the brain, but some people can be loaded with lesions and kind of be relatively okay. Somebody else can have a lesion just in the wrong spot, and then suddenly they can't move their leg, or they can't, they have trouble with vision or something like that. And the end process here, while there's an immunological attack on the white matter tracts, that usually causes damage through something called oxidative damage, obviously a pretty common concept in the biological world. And so one of the thoughts has been over the years is can you give an antioxidant? And if so, is that something that could actually help these individuals? So we've been working with a molecule called N-acetylcysteine. Sorry. And what we have found in general is that when you look at functional connectivity in the brain, and when you look at different changes in the brain, that there are significant changes in a number of brain regions, the temporal lobe, particularly frontal lobe, caudate nucleus, that correlate with different changes that we can observe in the brain function itself. And then when you look at things like, sorry, here we go. So here was an arterial spin labeling study. So here you have a person who is receiving N-acetylcysteine, and on the top image on the left, and you can see that it's mostly kind of bluish. And then when they come back after receiving N-acetylcysteine for a couple of months, that it's at least more yellows and greens. So they've actually increased the amount of cerebral blood flow in their brain, which tells us that functionally their brain seems to be working a little bit better. When we look at the control individual who did not get the N-acetylcysteine, but just went through a control period, we don't see very much change. In fact, if anything, some of the areas that were previously red are actually a little bit lower in activity. So what we were showing ultimately is that there tends to be kind of a drift towards not functioning as well in people just kind of going through the natural process of multiple sclerosis. Whereas if you give people N-acetylcysteine, it kind of wakes their brain up a little bit. And that was part of, not only do we see this physiologically, but people say, yeah, I had a little bit more energy. I felt like I could think better. I was, a little bit more cognitively had more cognitive abilities to do things. So again, these are the kinds of things that we can do and look at with fMRI. We did an insomnia study where we took people who have a lot of issues with sleep, and we gave them an intervention that involved kind of auditory and as well as vibratory stimulation. So, many of you, if you've ever had trouble sleeping, you put on some earphones and you listen to some nice, background music or waves or something like that. So clearly that can kind of improve the way your brain is responding and hopefully get you to sleep. Even vibrations. I mean, if any of you ever had kids, what do you do when you want to get them to sleep? You put them in the car, right? Because you got the vibration and the noise or something like that. People fall asleep on a plane, on a train. So the thought was, can we show that? Can we potentially see whether that might be effective for people? And basically, when we looked at functional connectivity, we see a lot of changes going on in the treatment group, particularly in the cerebellum, which I thought was kind of interesting, but makes sense because that's part of how we kind of perceive motor processes, how we understand what's going on in the body itself. And then some of the other sensory motor areas, for example. So basically, this kind of made a lot of sense to us that you're affecting the sensory motor area, the cerebellum, and even maybe some central areas like the thalamus and the caudate, which have to do more with sleep itself. And we were able to show that people not only seem to be sleeping better, but they seem to be cognitively a little bit more doing better. And we start to see some of these changes in functional connectivity. One of the things that is interesting about functional connectivity, I mean, this is where the brain itself starts to get super complex, is that, is it better to have more connectivity or less connectivity? And the answer is yes. I mean, it sort of depends on what's going on. If you have kind of an overstimulation of areas, then you want to decrease the connectivity because you want some area of the brain is overstimulating another area. You want to try to break that cycle, and that we see that in overstimulatory states, anxiety states, and so forth. On the other hand, sometimes you might want to augment functional connectivity so that you can create a better, cognitive processing between the frontal lobe and the temporal lobe or something like that. So it usually kind of modulates these effects, but sometimes it makes it better. Sometimes it increases it, sometimes it decreases it, but whether that ultimately means better or worse depends on how the person is doing and what the overall picture is in terms of what you're trying to study. A couple of my colleagues have been working with an interesting integrative medicine approach that is called the neuro-emotional technique, or NET. It's an interesting approach that combines a variety of elements, including things like acupressure, cognitive therapy, exposure therapy. We have seen it being used for people who have a lot of stressors. So we've done it in specific patient populations, like patients with cancer. And when they think back on getting chemotherapy or getting radiation, it just they get very, very anxious and very stressed. We've been looking at it in people with concussion more recently. We've been looking at it in people with chronic pain, because even when you have chronic pain, you have the pain, but then over time you get anxious and you feel like, oh, I'm not going to be able to do my exercise, or I'm going to be in too much pain to be able to stay at work and do the things that I need to do in order to make a living and help my family and so forth. So it can kind of really ratchet up a lot of stressors. And the NET study, the NET program is something which theoretically can help with that. We wanted to test that. There's been clinical evidence that it's valuable, but does it have something physiologically that is going on that can be helpful for us to understand? And so one of the things that we did with this study, which was a little different than some of the other things that we've seen, is to do an activation paradigm. where what we did was we were working with cancer patients and we asked them what were their primary stressors, and we created an audio file that described their stressors. So sometimes it would be, remember when you were sitting in the doctor's office and they came in and they told you that, the breast cancer was worse than they thought it was, and you were going to need, not just chemotherapy, but radiation therapy or something like that. So, and then they would listen to this audio file while they were in the MRI scanner, while we did arterial spin labeling to look at how their brain was processing this information. And what you're seeing here in the crosshairs where this little red dot is, that's the amygdala. And of course, the amygdala is very commonly involved in anxiety and stress. It makes us to see things that are and react to things that are stressors for us. So when we played this stressor audio file, it activated their amygdala. Then we had them go through the NET program for about 5 or 6 weeks. They went through about 5 or 6 different sessions. And then we brought them back and we did the same exact paradigm. We put them back in the scanner. We had them listening to this audio file. And now when you look at that little red dot, this is what happened when they were listening to their audio file. If you can see it, it went away. So suddenly now their amygdala is no longer, just sort of play it back and forth again. So you can see where it's lit up and then it goes away. And so what the NET program seemed to be doing is now helping them to view this traumatic memory as just a regular memory instead of one that has a lot of emotional content to it. So again, just different ways of trying to look at things, think about things, and try to understand what's going on in the brain itself. We specifically looked at functional connectivity as well. So we can see that there are differences going on between the amygdala and the vermis, which is part of the cerebellum. This in and of itself was a really interesting finding that when we first saw this, we weren't sure what to make of it. As a medical student, usually what they tell you about the cerebellum is that all it does is motor coordination. But as a lot of research has been starting to develop since we did this study, people are realizing that not only does it seem to coordinate motor reactions, but it may also coordinate emotional responses as well. And this is one of the first studies that actually kind of surprised us, but we picked this up, reported it, and then that's been part of what's been going on now. More and more people are looking at how the cerebellum is involved in our emotional responses, particularly negative emotional responses, traumas, and so forth. So not only did we show that there was a connection, but we showed that we were able to kind of rearrange that connection through this particular program, this particular practice. This isn't quite a health-related study, but I just think it's really interesting, and the images, of course, are pretty cool. So we did a study, and again, also just gives you kind of like, these are other things that you can do. So this was a study that we did of highly creative individuals. So these were people who, kind of were almost professionally creative, artists, musicians. We even included people who were like comedians who do a lot of improv. So they have to be able to create on the spot. And we are looking at diffusion tensor imaging here. So you can see all of the connecting fibers. And one of the main things that you can see where the arrow is pointing on the left-hand side is that in the highly creative people, the red fibers that are in between the two hemispheres seem to be much more robust than what we see in the controls. And we see this kind of, somewhat universally in this particular group of highly creative individuals versus just normally creative individuals. I think this makes some interesting sense, that people often talk about right hemisphere versus left hemisphere functions. The left hemisphere tends to be a little bit more analytical. The right tends to be a little bit more, spatial and holistic and so forth. So the idea that maybe the more they can interact with each other, the more creative a person can be, because you do need both. If you're going to be a creative musician, you need to understand the kind of the technical details of tone and key and time signatures and all that. But then you want to do something that's creative as well on top of that. So the idea, you may have some really creative ideas about music, but if you don't understand how the notes work and all that, then that creativity doesn't go anywhere. So the combination of the two may be something that may be very helpful. And then the question is creativity the same across different domains? If you are a very creative musician, is that the same as being a creative painter, as being a creative psychologist, who's coming up with different ways of thinking about the world? You guys, for those of you in the engineering or whatever, being a creative engineer, is that the same as being a creative musician? So we can look at these kinds of interesting questions. through this kind of process. So as far as what's going on here, again, we basically launched the MRI facility, which is a core research facility here at FAU, really starting in the fall. It just, it took a lot of time to get the whole system going. It took a lot of time making sure that we had all of the operating procedures in place. And then, of course, since no one at FAU has been doing MRI research because we didn't have the scanner, it's now kind of the process of getting everything going. And it's been exciting to see this start to develop. So right now we have 4 main projects that are going on, which have to do one with an MR spectroscopy study that is looking at a particular metabolite, NADH, in patients with Alzheimer's. We have a study that's looking at foraging behaviors. So here we have what they're doing basically has to do a little bit with an anthropological perspective of, when you're kind of out looking for things, how long do you stay in one spot, kind of getting all of the whatever resources that you can potentially get, and then it's time to move on. So how do you make those decisions? How do you decide when you've kind of used up one particular area and moved on to another, and what's going on in the brain? So that's kind of cool. We have neurological effects related to pet therapy, canine pet therapy. Some people in the nursing department are doing that in veterans with PTSD. So again, we can do different, types of imaging with them. We can look at what's going on in their brain, how their brain is responding to anxiety signals, and then what's happening after you go through pet therapy, and see whether or not, being able to interact with the animals might have some benefit, and what it's doing physiologically in the brain. When aphantasia are people who can't visualize things. If I ask you to visualize a pizza, you can kind of put together an idea of what a pizza looks like, but they can't do that. And so the question is, how do you look at different neural representations of visual imagery in these individuals? Does that tell us something about the visual processing, about imagination, and so forth? I think somebody asked me this question earlier, but another faculty member here in the marketing department, so again, what does marketing have to do? But nowadays they kind of make neuro everything, right? So there's neuromarketing, there's neurolinguistics, neuroethics, and so forth. And so she's doing something very interesting about how people respond to different ways of presenting options for people. Is it better for you to have lots of different options all the time? Is it better for you to get a limited number of options, but having it always be changing, so that there's a novelty to it? So there's those kinds of things that we can begin to look at, and how does that affect the brain? Does the brain respond better or worse? And I'm also always about, individual differences as well. I mean, obviously there's some people who like lots of possibilities, and there's other people where you're like, hey, I really like vanilla ice cream, so having 31 flavors at Baskin & Robbins is nice, but it's irrelevant to me. Whereas other people are like, gee, no, I like trying this one day, and then, so it even gets down to the individual level. We have some people at the clinical research unit who are going to be doing work looking at cognitive function in people with mild cognitive impairment, which is kind of, on the road to Alzheimer's, and how that intersects with the microbiome. So obviously there's been a lot of interest in looking at microbiome effects and the bacterial content in our gut and on our bodies, and how that may have something to do with our brain's function, the whole gut-brain interaction. So we have that possibility as well, and that's a study that we're going to be doing. And then a couple of things that are coming down the pike. So one of the big things that we're going to be launching very soon is something called a focused ultrasound system. So Dr. Greg Fields, who's the Vice President of Research here at FAU, he's set aside the funds to be able to do this. So this is a special ultrasound system that's going to be kind of integrated into the MRI facility. And what it does is it emits kind of low-level ultrasound, which interestingly kind of alters the blood-brain barrier, and it allows more molecules to pass the blood-brain barrier. So the idea here, so many times therapeutic interventions are kind of stymied by the blood-brain barrier. You have a medication that theoretically should work great, but if you inject it or if you give it to somebody orally, it just doesn't get into the brain. So if you can use this ultrasound system to open up the blood-brain barrier to allow these medications to get into the brain, can it work, for cancers, for depression, for, whatever it is that you're looking for? So we're going to be looking at this particular system. And again, that has a lot of different therapeutic opportunities for different disorders. We're looking at the Karen Foundation, which has, I'm not sure if you're familiar with that, excuse me, but that is it's an addiction center that has actually a center here in Florida over in Delray Beach, and actually from my hometown, Philadelphia. So we're talking to them about, having patients come in who have addictions and be able to look at what's going on in their brain, how do their therapeutic interventions affect the brain. And of course, again, this could have different kinds of changes depending on whether they have addictions to alcohol, different specific drugs, multiple drugs, and so forth. So there's a lot of different possibilities there. We're looking at things like that. There's the Neuro Arts program. That to me is just, ripe with the ability to, how does art and, colors and music and all these different things affect our brain? How does the brain interact with different creative processes? Dr. Randy Blakely has developed the Center for the Resilient Mind. So that's going to be looking at different ways of helping our minds and our brains ultimately be more resilient. So whether that has to do with emotional processing, cognitive processing, and so we have hopefully a study that we're going to be looking at the effect of equine therapy in horses and how that may affect people's brains. I've done a lot of research looking at different mind-body practices like meditation and prayer and so forth, and how that affects the brain and may help it to be more resilient and so forth. So really, I mean, ultimately, the sky is the limit here when it comes to the ability to be able to explore what's going on, certainly in the brain. But even beyond that, I mentioned, for example, a study that we did with chronic pain. This was actually women who had chronic pelvic pain. So what we did was we scanned their brain, but we also scanned the pelvic area, looking for abnormalities, looking for inflammation. Is that affect, if you help them with sort of how their brain is responding to the pain, does that change how their body is responding? If we look at things, I mentioned the microbiome. So I've done some studies looking at irritable bowel syndrome. And we've looked at kind of what's going on in the gut and the gut motility and how that may be associated with changes that are going on in the brain itself. So all kinds of opportunities, all kinds of options, and a lot of exciting possibilities. So, ultimately, again, we really have the ability here. This is an exciting opportunity for everyone at FAU. It is open to the entire FAU campus and university. It's kind of really sits a little bit in between the Division of Research, which is for the university itself, and the School of Medicine. So, whether you're a medical doctor, whether you're in psychology, engineering, even like in things like physics, I mean, there's a lot of opportunities to be able to explore ways of developing MRI capabilities so that you can look at how the MRI scanner works. It's basically a big nuclear magnetic resonance machine. And so, how you might develop new techniques, new abilities to study different aspects of the brain or the body, all within possibility here. So MRI research really can incorporate multiple areas of intersection across the university. Again, kind of the sky's the limit. So, any idea you may have probably has some intersection with the brain or body in some way. And we have the potential to be able to explore how that may happen. We can look at, obviously, a lot of neurological and psychological issues. So mental and physical disorders, depression, anxiety, chronic pain, fatigue, you name it, all the different body physiological changes, cardiac. I didn't really mention that. I have a study that I'm working on still a little bit with my prior institution, where we're looking at congestive heart failure. And so you can look at how the heart is beating. You can look at how the heart is functioning. You can look at the blood vessels of the heart. So we can look at cardiac function, gastrointestinal function, musculoskeletal issues, and ultimately we can look at both just what's going on physiologically, but also how different interventions will affect that. And really, whether you're a student or faculty, look forward to anybody's interest and happy to have those conversations with you. So if you are interested, myself and our team are happy to talk to you. And so feel free to send me an email and reach out, and we will, you never know what might be an interesting thing or what might come down the pike, and see where it takes us. So I think like I said, it's a great opportunity for everyone, and look forward to hearing from all of you. So I'll stop there, and if people have some questions about any or all of this, to try to address them. And that includes the folks online. I think if you're online, you can, I think you can unmute yourself. We try to set it up so you can unmute yourself. I can't quite see you, so, well, actually here, I'll stop sharing.
We may already have a question in the.
We have a question in the chat, okay. Whoop. Oh, nope, that was just, thank you for the presentation. All right, great.
Thank you very much.
Feel free to shout out there, or anybody in here have a question or anything like that.
I have a quick question. As you know, there are another technology, FNIRS. Even though the special accuracy and resolution of fMRI is better than FNIRS, are you thinking also have that technology? Because maybe for some application, the resolution you have for fMRI for some application is not necessary, and FNIRS is less cost than, is not expensive like fMRI. And for some situation, for example, if you want to see what happened in the brain during some activity, like free walking like that, you cannot measure with fMRI.
Right, right. Yeah, thank you. So just to sort of, and you were talking about the near infrared imaging?
Yeah.
So the question was about, you know, other alternatives and specifically something like near infrared imaging, or what's called FNIRS. So no, it's a very good point. You know, every technique has its limitations, and it's, you know, has its sort of strengths and weaknesses. So MRI has the ability to do a lot of great things, but as you mentioned, you know, if it's something that has to do with how we begin to look at a person when they're walking or when they're moving or something like that, MRI is not going to be that useful. You know, MRI has some excellent capabilities in terms of temporal resolution. So, you know, one of the nice things is that you can kind of make multiple presentations of stimuli and be able to see exactly how the brain is operating, you know, even within seconds, so to speak, and has pretty good spatial resolution, you know, normally on the order of maybe like 4 to 5 millimeters or something in that ballpark. But again, you know, there's limits to what that's, you know, we're not looking at the neuronal level. And so, as one of my old mentors always used to say, you know, if you're a good carpenter, you have a lot of tools in your tool basket. So this is a great tool, but it can also work in conjunction with, you know, other things that may be available here. You know, you could say, okay, so what's happening with, you know, near infrared imaging in a particular context, but then how does that change functional connectivity, you know, afterwards or something like that. I should mention, and I think I started to say this, and maybe I thought there was going to be a specific slide that I thought I had in there, but the MRI scanner itself does have its own other tools. So we do have an EEG system, which is compatible with the MRI. So we could do EEG as well as, you know, MRI imaging. We have a kind of BioPack, it's called, so we can monitor things like heart rate, blood pressure, and so forth. So there are other physiological measures that we could potentially look at. And so, you know, and then of course there is the whole sort of ability to do functional paradigms. So we can present visual stimuli, auditory stimuli. There are buttons that people can control to respond, or you can, you know, listen to them in some kind of verbal response, depending on what you're interested in doing. It depends a little bit on what you want to, how you want to set it up. But yeah, I mean, ultimately, my background is also in nuclear medicine, and so, you know, we've done a lot of work looking at different radiopharmaceuticals, radioactive tracers. MRI is great for kind of general function, not so good for like neurotransmitter studies. So it can't look at like where dopamine is. Even when you do MR spectroscopy, if you have a multi-nuclei MR spectroscopy, even if you can see, you know, dopamine, it just tells you the concentration of dopamine. It doesn't tell you whether it's binding to receptors or not. So the nuclear medicine techniques where you can give different tracers that bind to D2 receptors, D3 receptors, dopamine transporter, presynaptic, postsynaptic, you know, like you can do a lot of different things. And again, I mean, sometimes being able to do combination studies of either like PET imaging and MRI or something like that. You know, in nuclear medicine for Alzheimer's, we're looking at like amyloid. So we don't have a way of looking at amyloid in the brain, but we can look at atrophy, we can look at blood flow, we can look at, you know, functional connectivity and things like that. So yeah, it's a great point, which is that there are, you know, a lot of different techniques that we have the potential to use. And this is just, you know, one particular one that has a lot to offer, but, you know, it does have its limitations. And part of what we would do if anybody was interested in coming to talk about a project, we would kind of, you know, assess, well, what is your question? Is this something we can do with the MRI? We might say, no, you know, we might want to do something different. And so, you know, and in fact, like with our study with the equine therapy, you know, we want people like riding on a horse. And so, you know, we can't do that with the MRI. So, you know, we look for other options like EEG or near infrared imaging to look at those.
Thank you for your presentation. Where is this instrument located?
So it's located on the campus here. It's in the building that's adjacent to the School of Medicine.
BC 17 what?
It's like ME 104, I think it is, or something.
Yeah.
Yeah, there's a little small building over there.
Oh, okay, okay.
So, and if you ever, the other thing that's actually a very kind of, you know, worked out well, and I don't know, hopefully it was somewhat purposeful, but it's in the same space basically as the clinical research unit. So the CRU, if you walk into the building on the first floor, the clinical research unit is on the left and the MRI facility is on the right, which is also good because you could use the clinical research unit to do like near infrared imaging or to do cognitive testing or, you know, something else, whatever your blood draws or whatever you want. And then you can walk the person across the hall and go into the MRI scanner and do, you know, whatever imaging you want, and then they can go back. So, you know, and some of our studies looking at things like the microbiome and so forth, you know, you can get different laboratory tests or do different things with the combination of the CRU and the MRI facility. But yeah, it's right on campus. So it is something, you know, it's great, obviously, access if there's like students who you might want to have, you know, even when I first started here, I remember you know, there's like projects looking at things like environmental effects, like the red tide and so forth. And I'm like, well, if people have like fatigue and issues going on, like let's scan their brain, you know, like you could look at what's going on physiologically. So, but yeah, I mean, people would have to physically come to the facility over there, but it's right here on campus.
Free or?
It's not free. That's a good question.
You practice in your research?
Yeah, so first of all, if people go to, you know, if you look up the core facility on the FAU website, you can get a lot of information there. And if you're interested, email me and I'll be happy to get to you. So the scans themselves, I mean, they are, you know, they cost something. They're not cheap, but they're not, you know, ridiculously expensive. Basically, the cost per scan is about $600 per scan. So for about an hour of imaging time. And so, you know, most of the stuff that people do is done. First of all, it's hard to keep someone in a scanner much longer than that. So usually, you know, either in the scanner for 45 minutes, 50 minutes, and it would be about $600 per scan. So it depends a little bit on what you're going to do. So we have a new study that's going to be done soon where he's just needs a single scan. He wants to see sort of where people's brains are today. If you want to do a pre and a post intervention, or you want to follow people over time so that they're going to get 2 or 3 scans, then, you know, you just have to multiply that out. So if you have a pre and a post scan, it'd be about $1,200 per patient, per subject. And then, you know, it depends a little bit on what you want to do. If you're going to do extra stuff like EEG, or if you want to talk to us about analysis and things like that, there can be some extra costs for that. But, you know, we're trying to, you know, it's for FAU. So, you know, we have to pay for it, but we don't want it to break the banks of people. And there are opportunities to get pilot money. So if somebody, you know, if you said, gee, you know, I have an NIH grant, but it doesn't include imaging, but if I can get some preliminary data, then I can apply, you know, the next time and include imaging, then we have ways of helping you get some funding to do, you know, 10, 15 subjects or something like that, get the preliminary data. So that then when you apply for a larger grant, you have the ability, you know, you have that information. You can say, I did feasibility, I got some preliminary data. You know, I can kind of do what I'm hoping to do, and now I need, you know, the extra money to do that. So again, it's not, you know, it's not cheap, but it's also not out of, you know, it's not millions of dollars, but, you know, and
for patient.
What's that?
The $600, right? $600
Per subject.
is for patient.
for each subject, but yeah, I mean, you know, it's all research. So I mean, obviously, the people who are study subjects, they never pay for anything.
If we use a small animal.
So yeah, so
What's-
there's gonna be cost for that too. It's the same. It's the same cost. Because it's sort of like an hourly cost.
Okay.
However, but that also, like, for example, if you can do a small, like, in other words, if you could do multiple animals or even multiple people within an hour, it's not per subject, it's really per hour. So for example, we have some people who are, I think in our neuromarketing study, which is a very brief, scan time, they're only in there for a half hour, so they can do 2 people in an hour, and therefore you're only paying half of that.
So if I do, I'm interested in, looking for, some blood flow, in mouse or rat, something like that. So how high the resolution would be showing the blood flow in real time or something?
Yeah, so I mean, so there's 2 answers with it when it comes to the animal studies. First of all, maybe the even better news is that they are in the process of getting a dedicated micro MRI scanner that would have much, more specific spatial resolution for small animals, and that's going to be, I believe, in the Jupiter campus. It's not here yet, probably like towards the end of the calendar year or something in that ballpark. Our facility theoretically can do animals. We have not specifically done them yet. So if if you were interested, we'd have to have a conversation about it. You're not going to be able to see, small structures in an animal. Like I said, it's going to be 3 to 4 millimeter resolution. So kind of figure that out in the context of the size of the brain of the animal.